Hello everyone, my name is Chris Baum and I will be discussing the traditional total shoulder arthroplasty. It can also be known as the total shoulder arthroplasty or a total shoulder replacement. And this can be conducted if a patient is suffering from humeral and glenoid arthritis and they currently have a functioning rotator cuff, or that rotator cuff can be repaired. The goal of this surgery is to relieve shoulder pain and improve range of motion. And the surgery is conducted by starting with an incision in the deltopectoral region. And the subscapularis tendon is removed so that the surgeon can replace the humeral head and the glenoid cup. Once those replacements are completed, the subscapularis tendon is reattached and the surgery is sewn up and completed. Since the subscapularis tendon was removed in the process of the surgery and reattached, there's a significant risk for anterior shoulder dislocation. With this increased risk, the post-operative precautions and restrictions are put in place to minimize that risk as much as possible. The patient's usually given a sling to immobilize the joint, and the patient is given instruction to not use their operated arm for any type of weight-bearing activity. There's also specific joint actions to aid the healing process and decrease the risk of the anterior dislocation. And these would be no shoulder extension, so no bringing the humerus behind the body, and no humeral external rotation, so rotating the shoulder externally. Even while sleeping, the patient is instructed to usually put a pillow under their humerus to avoid any external rotation or extension that may happen while they're sleeping. However, each surgeon will usually have their own specific range of motion protocols, but in general, the less range of motion, especially immediately following surgery, the better. So one activity that will be limited with these restrictions is putting on any type of jacket or zip up or button up shirt. And I will demonstrate that. So normally, if my right arm was being operated on, normally putting on some kind of shirt would look like that. There would be a lot of flexion, there would be some extension, there would be some external rotation. However, since that's not allowed following surgery, what the patient can do is they'll have to take their arm out of the sling, which they'll have to anyway to get dressed properly, and they can keep their arm straight, and they can slip the shirt or coat onto that arm and then use their other arm the rest of the way. And they are allowed to flex their elbow, so they would be able to button this if they wanted to, and then go back into the sling.